Good morning everyone. Welcome to one more very important topic in the field of anesthesia, accident and emergency and intensive care management. It's burns. Being a very big topic, we are going to see in two phases. One is the acute phase management. The other one is going to be a delayed presentation of burns management. First, let us move to the acute phase of burns management. So, what is burns? Burns is a coagulative destruction of the skin and its structures by thermal, chemical, electrical or mechanical energy. So, coming into the very important salient features about burns, that's any adult patient with the percentage total body surface area burned is more than 15% is considered as a major burns. If the burns involves more than 25% of total body surface area, it can result in severe systematic inflammatory response which might increase the incidence or increase the risk of death, that is morbidity and mortality is increased to a higher percentage. So, the key here is going to be the early resuscitation and surgical excision of injured area which can reduce the morbidity and mortality. So, going into the risk factors for burns and its associated morbidity and mortality, that's as we all know, low socioeconomic status, crowded households, poor safety practices, cooking with kerosene stoves, psychiatric illness, substance abuse and extremes of age, the risk of burns is going to be high. So, this is the schematic representation of the skin. As we all know, the structures are epidermis and dermis. The superficial portion epidermis, its role is very important, that is, it is going to be acting as a barrier of preventing the microorganisms enter into the skin. It is the it occupies the most important part of immune system of our body. So, the second thing is it is going to prevent the fluid loss to the maximal extent, and also it is very important, as we all know, the touch, pain and other sensations is going to be manifested through this epidermis. Coming to the dermis, the major blood vessels which supply blood supply to the epidermis also presents here. So, it is responsible for durability and flexibility of skin and also important for thermal regulation. So, burns patients, the most important part is maintain of a temperature which is going to be damaged if the burns is going to involve the dermis also. So, when we see these structures, we can come to a conclusion that the epidermis cannot regenerate without dermis because the dermis contains blood supply to the epidermis also. So, deeper layer of epidermis continually divide and migrate to the superficial layers to regenerate every 2-3 weeks in a normal scenario also. So, coming to the classification of burn injuries. Burn injuries are classified depending upon the depth of involvement, that is first degree burns which includes only superficial or epidermal structures, second degree burns that is partial thickness burns and third degree that is full thickness burns. So, when the damage is to the epidermis only, it is called a superficial or epidermal burns, and these burns usually heal on its own and within a week, within a 1 to 2 weeks period without scarring itself. So, when the burns involve the epidermal structures only, then we need not calculate the surface area for a resuscitation of burns. If it involves a deeper structures, that is dermis, it is called as partial or thickness burns, and depending on the depth of involvement, it can be partial thickness or deep or full thickness burns, it is called as so. So, coming to the burn injury can be classified again into burn related or patient related. For example, when the burn is due to dry heat, it produces damage, whereas if it is due to wet heat, that is scalds, the damage is going to be more because the tissue damage is high. What about patient related burn injury? That is the skin thickness of the patient, age of the patient, whether the patient was attended to early and first aid was given early. Depending on this, the injury might vary. So, the superficial partial thickness burns have a very good blood supply, hence regeneration will be early and sufficient regeneration of abdominal tissue takes place early. So, it usually heals within 1 to 2 weeks without much scarring, whereas a deep partial thickness or full thickness burns, the dermis and blood vessels in the vascular plexus in the dermis are lost. So, the cells to heal are going to be very high, so very less in numbers. So, it needs a higher attention and successive skin grafting and other sclerotomy or like procedures are needed for complete recovery. So, the important thing here is if the muscle deeper to the dermis is also involved, it can result in compartment syndrome and a dangerous complication like rhabdomyolysis. So, this is the one more microscopic representation of the burns. Here you can see the superficial structure epidermis, dermis and the subcutaneous tissue. Below, deep to that will be the muscle layers. So, when the muscle layers are involved, the result of it can result in rhabdomyolysis and dangerous complications of renal shutdown and other things can occur. So, coming to this, If it involves only the epidermis, it's called a superficial burns, which can regenerate easily without much attention and scarring. If it involves a part of dermis, again the regeneration chances are also high because it does not include the blood vessels, but it takes time. When it involves the deeper structures or entire dermis, sufficient tissue for regeneration doesn't have sufficient tissue for regeneration, and hence it needs greater attention, and grafting and other supports are needed.